Okay, so I am Max Skelton. I am the Executive Director of the Institute of Regional and International Studies at the American University of Iraq in Suleimania. So one of the main themes that I was touching on today is that it's very important for us to have the right kinds of terms and concepts when we're entering into discussion about climate governance. Oftentimes we use words like climate security, and these words are at one level, understandable. There are, of course, linkages between climate and conflict and displacement. However, oftentimes we use terms that bring together actors that are not actually the best suited actors to solve the problems that we need to solve. So a lot of times with climate security, what you see around the table are security actors, national security advisors, generals. These are folks that are going to be taking what are very complex problems of governance, problems of politics, and reducing them to a security problem. And then think tanks and researchers often kind of come into these conversations in ways that they end up serving these agendas that aren't very constructive. So I just think that one thing that this initiative, the Arab Reform Initiative, and this conference has been about is to try and say, look, we need to have a more holistic understanding of how these problems are rooted in local political contexts, in historical contexts that are more complicated than just a security framework. Health is one of these domains within the kind of climate policy conversation that's often on the sidelines. We don't have a panel that's specifically on health here, and that's understandable. It's one of these topics that somehow has been left on the edges, not just here, but at many other conferences. And the reason why it is so important is because when you think about any issue related to the environment or water, health is central. So even if you're thinking about water scarcity, as soon as you have water scarcity, you have higher concentrations of pollutants. Higher concentrations of pollutants lead to things like cholera, typhoid, waterborne illnesses. Also with climate change, you have things like antimicrobial resistance becoming more prevalent. You have zoonotic diseases that become more of an issue. And all of these kind of health, this environmental health nexus requires policy solutions that involve different actors at different levels of government. So you need to have public health response, you need to have water and sanitation, you need to have water management. And usually all of these different domains are under different governmental authorities. And so if you want to solve health problems, you have to do this interagency, complicated negotiation. And that work is complicated, and so a lot of times climate actors and activists don't really feel like they know how to engage it, when actually my message is often that, in fact, it's not that complicated. It just sounds that way because we're dealing with diseases, communicable diseases or whatever. We kind of too easily think, this is not my issue, I'm not a doctor, right? When actually these are technical domains and spaces that we have to learn how to engage constructively.